1. What is the priority nursing action for a patient with sickle cell anemia experiencing a vaso-occlusive crisis? A. Administer oxygen therapy. B. Encourage ambulation. C. Administer pain medication. D. Restrict fluid intake. Answer: C. Administer pain medication. Rationale: in a vaso-occlusive crisis, sickle-shaped red blood cells obstruct blood flow, causing severe pain. The priority is to manage pain to improve patient comfort and prevent further complications. Administering pain medication, C, addresses this urgent need. Oxygen therapy, A, is appropriate if hypoxia is present, but pain is the primary concern. Encouraging ambulation, B, may worsen pain and is contraindicated during a crisis. Restricting fluids, D, is incorrect as hydration is essential to reduce blood viscosity and promote circulation. 2. A patient with leukemia has a white blood cell count of 2,000/mm superscript 3. What is the most important nursing intervention? A. Encourage a high-protein diet. B. Implement infection control measures. C. Administer iron supplements. D. Promote frequent ambulation. Answer: B. Implement infection control measures. Rationale: a white blood cell count of 2,000/mm superscript 3 indicates leukopenia, increasing the risk of infection in a patient with leukemia. Implementing infection control measures, B, such as hand hygiene and protective isolation, is critical to patient safety. A high-protein diet, A, may support overall health, but is not the priority. Iron supplements, C, are irrelevant to leukopenia and may be contraindicated. Frequent ambulation, D, does not address the immediate risk of infection. 3. A nurse is caring for a patient receiving a blood transfusion. Which symptom indicates a possible transfusion reaction? A. Increased energy levels. B. Fever and chills. C. Improved skin color. D. Decreased heart rate. Answer: B. Fever and chills. Rationale: fever and chills, B, are classic signs of a transfusion reaction, such as a febrile non-hemolytic reaction, and require immediate intervention, including stopping the transfusion. Increased energy levels, A, and improved skin color, C, suggest a positive response to the transfusion, not a reaction. A decreased heart rate, D, is not typically associated with a transfusion reaction, which often causes tachycardia. 4. A patient with hemophilia A is admitted with joint swelling. What is the nurse's first action? A. Apply a warm compress to the joint. B. Administer factor VIII replacement. C. Encourage active range of motion. D. Administer oral analgesics. Answer: B. Administer factor VIII replacement. Rationale: hemophilia A is characterized by deficient factor VIII, leading to bleeding into joints, causing swelling and pain. The first action is to administer factor VIII replacement, B, to stop bleeding and prevent further damage. Warm compresses, A, are contraindicated as heat may increase bleeding. Active range of motion, C, could worsen bleeding and is avoided during acute episodes. Oral analgesics, D, may help with pain but do not address the underlying bleeding. 5. A nurse is educating a patient with iron deficiency anemia. Which food should the nurse recommend to increase iron intake? A. White bread. B. Spinach. C. Bananas. D. Milk. Answer: B. Spinach. Rationale: spinach, B, is a rich source of iron, particularly non-heme iron, which is beneficial for patients with iron deficiency anemia. White bread, A, has low iron content and is not a good source. Bananas, C, are high in potassium but not iron. Milk, D, is a poor source of iron and may inhibit iron absorption if consumed in excess. The nurse should also educate the patient on consuming vitamin C-rich foods to enhance iron absorption. 6. A patient with thrombocytopenia has a platelet count of 40,000/mm superscript 3. What is the nurse's priority action? A. Administer platelet transfusion. B. Encourage vigorous toothbrushing. C. Apply heat to bruised areas. D. Allow the patient to ambulate freely. Answer. A. Administer platelet transfusion. Rationale. A platelet count of 40,000/mm superscript 3 indicates severe thrombocytopenia, increasing the risk of bleeding. The priority is to administer a platelet transfusion, A. To restore platelet levels and prevent hemorrhage. Vigorous toothbrushing, B. Can cause gum bleeding and is contraindicated. Applying heat, C. May worsen bruising or bleeding. Unrestricted ambulation, D. Increases the risk of injury and bleeding, so safety precautions are needed. 7. A nurse is monitoring a patient receiving heparin therapy. Which laboratory value should the nurse prioritize? A. Hemoglobin. B. Activated partial thromboplastin time, APTT. C. White blood cell count. D. Serum potassium. Answer. B. Activated partial thromboplastin time, APTT. Rationale. Heparin is an anticoagulant, and its therapeutic effect is monitored by the APTT-B, which assesses clotting time to ensure safe dosing. Hemoglobin, A. Monitors for anemia or bleeding but is not specific to heparin. White blood cell count, C. Is unrelated to heparin monitoring. Serum potassium, D. Is not directly affected by heparin therapy. 8. A patient with pernicious anemia is prescribed vitamin B12. What is the most effective administration route? A. Oral tablets. B. Intravenous infusion. C. Intramuscular injection. D. Sublingual drops. Answer. C. Intramuscular injection. Rationale. Pernicious anemia results from an inability to absorb vitamin B12 due to intrinsic factor deficiency. Intramuscular injection, C. Bypasses the gastrointestinal tract, ensuring effective delivery. Oral tablets, A, and sublingual drops, D, are ineffective due to poor absorption. Intravenous infusion, B, is not a standard route for vitamin B12 administration. 9. A patient with chronic lymphocytic leukemia reports fatigue and night sweats. What is the nurse's best response? A. Encourage increased physical activity. B. Assess for signs of infection. C. Recommend a low-iron diet. D. Suggest warm baths before bedtime. Answer. B. Assess for signs of infection. Rationale. Fatigue and night sweats in chronic lymphocytic leukemia may indicate infection, a common complication due to impaired immunity. Assessing for infection, B, is the priority to ensure timely intervention. Increased physical activity, A, may exacerbate fatigue. A low-iron diet, C, is irrelevant to leukemia. Warm baths, D, may provide comfort but do not address the underlying issue. 10. A nurse is caring for a patient with a hemoglobin level of 7G/DL. Which intervention is most appropriate? A. Encourage a high-fiber diet. B. Prepare for blood transfusion. C. Administer oral antibiotics. D. Promote deep breathing exercises. Answer. B. Prepare for blood transfusion. Rationale. A hemoglobin level of 7G/DL indicates severe anemia, requiring a blood transfusion, B, to restore oxygen carrying capacity. A high-fiber diet, A, is unrelated to anemia treatment. Antibiotics, C, are not indicated unless infection is present. Deep breathing exercises, D, may help with oxygenation but do not correct the underlying anemia. 11. A patient with sickle cell disease is admitted with chest pain and dyspnea. What conditions should the nurse suspect? A. Acute chest syndrome. B. Pulmonary edema. C. Myocardial infarction. D. Pneumothorax. Answer. A. Acute chest syndrome. Rationale. Acute chest syndrome, A, is a life-threatening complication of sickle cell disease characterized by chest pain and dyspnea due to vaso-occlusion in the lungs. Pulmonary edema, B, is less likely without heart failure signs. Myocardial infarction, C, is possible but less common in sickle cell patients. Pneumothorax, D, is unrelated to sickle cell pathophysiology. 12. A nurse is teaching a patient with hemophilia about injury prevention. Which instruction is most important? A. Avoid contact sports. B. Increase calcium intake. C. Use a soft toothbrush. D. Wear loose clothing. Answer: A. Avoid contact sports. Rationale: hemophilia increases bleeding risk, so avoiding contact sports, A, is critical to prevent trauma-induced hemorrhages. Increasing calcium, B, is unrelated to bleeding prevention. A soft toothbrush, C, is helpful but less critical than avoiding trauma. Loose clothing, D, does not directly prevent injury. 13. A patient receiving warfarin has an INR of 5.2. What is the nurse's first action? A. Administer vitamin K. B. Increase the warfarin dose. C. Encourage green leafy vegetables. D. Continue current therapy. Answer: A. Administer vitamin K. Rationale: an INR of 5.2 indicates excessive anticoagulation, increasing bleeding risk. Administering vitamin K, A, reverses warfarin's effect. Increasing the dose, B, worsens the risk. Green leafy vegetables, C, contain vitamin K and may reduce warfarin's effect, but are not an immediate solution. Continuing therapy, D, is unsafe without correction. 14. A patient with iron deficiency anemia reports taking iron supplements with milk. What should the nurse advise? A. Continue taking with milk. B. Take with orange juice. C. Take with a high-fiber meal. D. Take before bedtime. Answer: B. Take with orange juice. Rationale: iron absorption is enhanced by vitamin C, found in orange juice. B. Milk, A, contains calcium, which inhibits iron absorption. High-fiber meals, C, may reduce absorption. Taking iron before bedtime, D, is not optimal for absorption and may cause gastrointestinal upset. 15. A nurse is assessing a patient with disseminated intravascular coagulation, DIC. Which finding is most concerning? A. Prolonged bleeding from venipuncture sites. B. Blood pressure of 120/80 mmHg. C. Heart rate of 80 bpm. D. Respiratory rate of 16 breaths/min. Answer: A. Prolonged bleeding from venipuncture sites. Rationale: DIC causes abnormal clotting and bleeding, making prolonged bleeding from venipuncture sites, A, a critical sign requiring immediate intervention. Blood pressure, B, heart rate, C, and respiratory rate, D, are normal and not indicative of DIC complications. 16. A patient with polycythemia vera is at risk for which complication? A. Thrombosis. B. Osteoporosis. C. Hypoglycemia. D. Renal failure. Answer: A. Thrombosis. Rationale: polycythemia vera causes increased red blood cell production, leading to hyperviscosity and a high risk of thrombosis. A. Osteoporosis, B, hypoglycemia, C, and renal failure, D, are not directly associated with this condition. 17. A nurse is preparing a patient for a bone marrow biopsy. What is the priority nursing action? A. Administer a sedative. B. Obtain informed consent. C. Encourage fluid intake. D. Apply a warm compress. Answer: B. Obtain informed consent. Rationale: a bone marrow biopsy is an invasive procedure, so obtaining informed consent, B, is the priority to ensure the patient understands the risks and benefits. Administering a sedative, A, may follow, but is not the first step. Fluid intake, C, and warm compresses, D, are not relevant to the procedure. 18. A patient with aplastic anemia is at risk for which condition? A. Infection. B. Hypertension. C. Hyperglycemia. D. Joint pain. Answer: A. Infection. Rationale: aplastic anemia causes decreased production of all blood cells, including white blood cells, increasing infection risk. A. Hypertension, B, hyperglycemia, C, and joint pain, D, are not directly related to aplastic anemia. 19. A nurse is caring for a patient with a history of deep vein thrombosis, DVT. Which instruction is most important? A. Avoid prolonged sitting. B. Increase sodium intake. C. Perform vigorous exercise. D. Wear loose stockings. Answer: A. Avoid prolonged sitting. Rationale: Prolonged sitting increases venous stasis, a risk factor for DVT recurrence, so avoiding it, A, is critical. Increasing sodium, B, is unrelated and may cause fluid retention. Vigorous exercise, C, may dislodge a clot. Loose stockings, D, do not provide the compression needed to prevent DVT. 20. A patient with multiple myeloma reports bone pain. What is the nurse's best action? A, encourage weight-bearing exercises. B, administer prescribed analgesics. C, apply ice to affected areas. D, restrict calcium supplements. Answer: B, administer prescribed analgesics. Rationale: multiple myeloma causes bone pain due to lytic lesions, so administering prescribed analgesics, B, is the best action to manage pain. Weight-bearing exercises, A, may increase fracture risk. Ice, C, is less effective for bone pain. Calcium supplements, D, may be needed due to hypercalcemia risks in multiple myeloma. 21. A nurse is reviewing a patient's complete blood count, CBC. Which finding indicates anemia? A, hemoglobin 10G/DL. B, white blood cell count 8,000/mm superscript 3. C, platelet count 200,000/mm superscript 3. D, hematocrit 45%. Answer: A, hemoglobin 10G/DL. Rationale: hemoglobin 10G/DL, A, is below the normal range, 12 to 16 G/DL for females, 14 to 18 G/DL for males, indicating anemia. White blood cell count, B, platelet count, C, and hematocrit, D, are within normal ranges and do not indicate anemia. 22. A patient with Hodgkin lymphoma reports enlarged lymph nodes. What should the nurse assess next? A, presence of fever and weight loss. B, blood glucose levels. C, joint mobility. D, skin turgor. Answer: A, presence of fever and weight loss. Rationale: enlarged lymph nodes in Hodgkin lymphoma may be accompanied by B symptoms, fever, weight loss, night sweats, so assessing for these, A, is critical. Blood glucose, B, joint mobility, C, and skin turgor, D, are not directly related to lymphoma assessment. 23. A nurse is administering packed red blood cells. How long should the transfusion take? A, 30 minutes. B, 1 hour. C, 2 to 4 hours. D, 6 hours. Answer: C, 2 to 4 hours. Rationale: packed red blood cells should be transfused over 2 to 4 hours, C, to prevent fluid overload and ensure safety. 30 minutes, A, or 1 hour, B, is too fast, risking complications. 6 hours, D, is too long, increasing the risk of bacterial contamination. 24. A patient with folate deficiency anemia is prescribed folic acid. What should the nurse monitor? A, blood pressure. B, serum folate levels. C, respiratory rate. D, urine output. Answer: B, serum folate levels. Rationale: folic acid therapy aims to correct folate deficiency, so monitoring serum folate levels, B, assesses treatment effectiveness. Blood pressure, A, respiratory rate, C, and urine output, D, are not directly affected by folate therapy. 25. A patient with a history of pulmonary embolism is prescribed enoxaparin. What should the nurse teach the patient? A, inject into the thigh. B, monitor for signs of bleeding. C, take with meals. D, avoid vitamin K supplements. Answer: B, monitor for signs of bleeding. Rationale: enoxaparin is a low molecular weight heparin, and bleeding is a major risk, so monitoring for signs of bleeding, B, is critical. Enoxaparin is injected into the abdomen, not the thigh, A. It is not taken orally, C. Vitamin K, D, affects warfarin, not enoxaparin. 26. A nurse is caring for a patient with sickle cell anemia. Which intervention promotes hydration? A, limit fluid intake to 1 L/day. B, encourage oral fluid intake. C, administer diuretics. D, restrict sodium intake. Answer: B, encourage oral fluid intake. Rationale: hydration reduces blood viscosity in sickle cell anemia, preventing vaso-occlusion, so encouraging oral fluid intake, B, is appropriate. Limiting fluids, A, is contraindicated. Diuretics, C, cause dehydration. Sodium restriction, D, is not directly related to hydration in this context. 27. A patient with thalassemia major requires frequent blood transfusions. What complications should the nurse monitor? A, iron overload. B, hypokalemia. C, hyperglycemia. D, osteoarthritis. Answer: A, iron overload. Rationale: frequent transfusions in thalassemia major lead to iron overload, A, causing organ damage. Hypokalemia, B, hyperglycemia, C, and osteoarthritis, D, are not directly related to transfusion complications. 28. A nurse is assessing a patient with a suspected bleeding disorder. Which finding supports this diagnosis? A, petechiae on the skin. B, blood pressure 130/85 mmHg. C, respiratory rate 18 breaths/min D, temperature 98.6 degrees Fahrenheit. Answer: A, petechiae on the skin. Rationale: petechiae A are small, pinpoint hemorrhages indicating a bleeding disorder, such as thrombocytopenia. Blood pressure, B, respiratory rate, C, and temperature, D, are normal and not specific to bleeding disorders. 29. A patient with chronic myeloid leukemia is prescribed imatinib. What should the nurse teach the patient? A, take on an empty stomach. B, avoid sun exposure. C, limit fluid intake. D, increase dietary fiber. Answer: A, take on an empty stomach. Rationale: imatinib is most effective when taken on an empty stomach. A, to ensure optimal absorption. Sun exposure, B, is not a specific concern with imatinib. Fluid intake, C, should not be limited. Dietary fiber, D, is unrelated to imatinib administration. 30. A nurse is caring for a patient with a prothrombin time, PT, of 20 seconds. What does this indicate? A, normal coagulation. B, increased bleeding risk. C, infection. D, anemia. Answer: B, increased bleeding risk. Rationale: a PT of 20 seconds is prolonged. Normal is 11 to 13.5 seconds, indicating increased bleeding risk. B, due to impaired clotting. It does not indicate normal coagulation. A, infection. C, or anemia. D. 31. A patient with anemia reports shortness of breath during activity. What is the nurse's best action? A, administer supplemental oxygen. B, encourage vigorous exercise. C, restrict fluid intake. D, apply a warm compress. Answer: A, administer supplemental oxygen. Rationale: shortness of breath in anemia results from reduced oxygen carrying capacity, so administering supplemental oxygen, A, is appropriate. Vigorous exercise, B, may worsen symptoms. Fluid restriction, C, is not indicated. A warm compress, D, is irrelevant to the symptom. 32. A nurse is preparing a patient for a splenectomy due to hemolytic anemia. What is the priority preoperative teaching? A, importance of early ambulation. B, risk of infection post-surgery. C, need for a low-iron diet. D, avoidance of deep breathing. Answer: B, risk of infection post-surgery. Rationale: splenectomy increases infection risk due to the spleen's role in immunity, so teaching about infection prevention, B, is critical. Early ambulation, A, is important but secondary. A low-iron diet, C, is not relevant. Deep breathing, D, should be encouraged to prevent respiratory complications. 33. A patient with a history of heparin-induced thrombocytopenia, HIT, requires anticoagulation. Which medication is safest? A, heparin. B, warfarin. C, argatroban. D, enoxaparin. Answer: C, argatroban. Rationale: HIT is a serious complication of heparin, so heparin, A, and enoxaparin, D, are contraindicated. Argatroban, C, a direct thrombin inhibitor, is safe for HIT patients. Warfarin B is not ideal initially due to delayed onset and risk of thrombosis in HIT. 34. A nurse is caring for a patient with a hematocrit of 25%. What is the priority intervention? A. Encourage a high-protein diet. B. Prepare for blood transfusion. C. Administer oral analgesics. D. Promote bed rest. Answer. B. Prepare for blood transfusion. Rationale: a hematocrit of 25% indicates severe anemia requiring a blood transfusion. B. To correct oxygen carrying capacity. A high-protein diet, A, supports recovery but is not immediate. Analgesics, C, are not indicated. Bed rest, D, may prevent exertion but does not address the anemia. 35. A patient with lymphoma is receiving chemotherapy. What should the nurse monitor for as a common side effect? A. Neutropenia. B. Hyperkalemia. C. Hypocalcemia. D. Joint stiffness. Answer. A. Neutropenia. Rationale: chemotherapy often causes neutropenia. A. Increasing infection risk due to reduced white blood cells. Hyperkalemia. B. Hypocalcemia. C. And joint stiffness. D. Are less common side effects of chemotherapy for lymphoma. 36. A patient with sickle cell anemia is experiencing fatigue and pallor. What is the nurse's priority action? A. Administer pain medication. B. Assess oxygen saturation. C. Encourage high-calorie snacks. D. Restrict physical activity. Answer. B. Assess oxygen saturation. Rationale: fatigue and pallor in sickle cell anemia suggest reduced oxygen carrying capacity due to anemia or vaso-occlusion. Assessing oxygen saturation, B, is the priority to determine if hypoxia is present. Pain medication, A, is indicated for pain, not fatigue. High-calorie snacks, C, support nutrition but are not immediate. Restricting activity, D, may be appropriate but does not address the underlying issue. 37. A nurse is monitoring a patient with a history of von Willebrand disease. Which symptom indicates a bleeding episode? A. Epistaxis. B. Hypertension. C. Fever. D. Weight gain. Answer. A. Epistaxis. Rationale: von Willebrand disease impairs clotting, making epistaxis, nosebleeds, A common sign of a bleeding episode. Hypertension, B, fever, C, and weight gain, D, are not directly related to bleeding in this condition. 38. A patient with acute myeloid leukemia is prescribed chemotherapy. What is the nurse's priority teaching? A. Maintain a low-sodium diet. B. Monitor for signs of infection. C. Increase calcium intake. D. Avoid deep breathing exercises. Answer. B. Monitor for signs of infection. Rationale: chemotherapy suppresses bone marrow, causing neutropenia and increasing infection risk. Teaching the patient to monitor for infection signs, B, is critical. Low-sodium diet, A, and calcium intake, C, are unrelated to chemotherapy. Deep breathing, D, should be encouraged to prevent respiratory complications. 39. A nurse is caring for a patient receiving a platelet transfusion. Which action ensures safety? A. Infuse over 4 hours. B. Check vital signs before and during transfusion. C. Use a standard 4 catheter. D. Administer without a filter. Answer. B. Check vital signs before and during transfusion. Rationale: monitoring vital signs before and during a platelet transfusion, B, detects early signs of a transfusion reaction, ensuring safety. Platelets are infused over 15 to 30 minutes, not 4 hours. A microaggregate filter is needed, not a standard catheter, C, or no filter, D. 40. A patient with iron deficiency anemia reports constipation from iron supplements. What should the nurse suggest? A. Stop taking the iron. B. Increase dietary fiber. C. Take with milk. D. Reduce fluid intake. Answer. B. Increase dietary fiber. Rationale: constipation is a common side effect of iron supplements. Increasing dietary fiber, B, helps alleviate this. Stopping iron, A. Is not advisable without physician consultation. Taking with milk. C. Reduces iron absorption. Reducing fluid intake. D. Worsens constipation.